I'm Dr. Marcia Sonity,
And I'm Dr. Caleb Moore,
and this is
the Free Smiles Podcast. Welcome back, everyone. Today we are discussing fluoride.
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 Fluoridation.
Fluoridation, is it good? Is it bad? Should it be banned?
Everything. Well, yeah, and I think so. It's interesting because this is becoming a topic of conversation, which
It
I
is.
think just kind of goes into all the things that we're now kind of opening up conversations about in our healthcare, because not everything should be as it was, and I think there should be. I think we should always question, why things are happening. At least I think
Exactly.
that's a healthy thing. I think understanding why, understanding the risk factors, and understanding what's right for you isn't usually the answer for everyone. So that's always the caveat of any kind of public health solution for health problems is a one size
Yep.
fits all approach doesn't usually solve all the problems, and sometimes it creates problems as well.
I think back to even when I was in hygiene school and we learned about the regulations for fluoride, what the max should be in a city or an area, and even supplements that people may have to take if there's not enough. I think back to that and thinking, well, even in my hometown when I was growing up, there were people in that city that had well water or they didn't have any fluoride at all.
Mhm.
And were they getting cavities? Like, were they actually, worse off because of that? Or were they totally okay? And so I think at the time, I didn't have the answer for that. But like you said, even the thought process of I'm not just going to be told that every city should have, this amount of fluoridation or
Mhm.
this is how much you should be consuming. But if you aren't, what is the side effect of that? And if you are there side effects?
Yeah, and I always think about things anthropologically because that's where my head goes. So when we think about, you know, ancient humans, they didn't have cavities, they didn't
Hmm.
have periodontal disease, they had the right size jaws to fit in their head, they didn't have crowding of their teeth, they didn't have any of these issues. So to me, all of the root causes of problems comes down to our environmental factors, our modern diets, and how that's changed pretty much like our epigenetics at this point. So
Right.
to me, when I think of water fluoridation, and I used to be, I grew up in the same way. Like I went, I think I had well water when I was younger. We didn't do supplements or anything. At that time, I don't think it was as talked about. We were really into the country when I was first born, and then I had a lot of cavities when I was a kid, but I also had a really bad diet when I was a kid.
Yeah.
And to me, it wasn't about we never went to the dentist either. So,
Right.
it was just like all this neglect of my health in general. Probably it was really the cause of those issues. Because then I did have fluoridated water. I think I was on city water after like age 2 or something like that. But when I'm really thinking about it, it's it's really getting onto the root cause of things. And I'm now more, as an adult, I'm now more skeptical at what a public health professional or someone wants to do to try to fix the problem. And I think it's always coming from a good place.
Hmm.
I think people who kind of created the fluoridation part of things, and I know more of this history because I actually just talked about this at a lecture I was at a couple weeks ago. And I think the history of it comes from a couple different things. I don't think I'm going to get into that today necessarily. But I think in general, dentists, they want to help their patients, and
Yes.
they want to see them disease free. They don't
Yep.
like to have you come in and be like, oh, we have another cavity, or we have another issue. So how do we mitigate that at a global scale? Because caries rate isn't decreasing as we
Hmm.
have more fluoridation in our water. We're seeing more and more early childhood caries, early tooth loss. All these things are happening, but we have fluoride everywhere. We have fluoride in our toothpaste. We have it in our mouthwashes. We have it in our water supply. Like it's everywhere. But then again, the issue isn't being solved really. So it's like, what is the solution here? You
Exactly.
know?
It's a really good point because a personal experience of mine, both of my sisters are anti-fluoride.
Mhm.
Like, there are a lot of people in this country who may be on the extreme ends of completely against something or they're completely for it. And I respect everyone's choice and their decisions, but at the same time, let me circle back. So when we were growing up, we had fluoridated water in our home. And like kind of like you, going to the dentist wasn't a priority. We had a diet full, things came in out of boxes, out of the
Mhm.
freezer, or it was snacking, right? It was what
Yep.
was easy, and it was just the environment that we were in. I had many cavities growing up,
Mhm.
even though I had fluoridated water. Fast forward to now, my sister, who's an amazing mom, they both are. However, my one sister, she was always like, "What toothpaste can I use for my kids that doesn't have fluoride in it? I just
Mhm.
don't want them to have it." And for me, I was like, "Okay, well, we can recommend some xylitol toothpaste." However, the concern isn't whether or not there's fluoride in it. It's the habits, it's
Mhm.
the lifestyle, it's the diet, it's what are you feeding your kids, and what is their exposure to acidity. And just know that even if you were using a fluoridated toothpaste, if they are drinking out of a juice or a sippy cup all day long, they're going to have cavities.
Mhm.
It's not about the fluoride quantity in the water, it's the exposure to that. And so even my mind has shifted over the years of, it's not about, if you're getting fluoride or not. If you're anti-fluoride or for fluoride, that doesn't really matter to me in terms of my recommendations are going to be to limit, your exposure to, like we talked about, fermentable carbohydrates, to
Mhm.
acidity, making sure that the pH in your mouth is balanced. That's the goal.
Yeah. I mean that's the root of it all. You know what I
Yeah.
mean? And I think we're hearing more conversations about this. There was a recent podcast that I just listened to as well. And I like to listen to podcasts that are similar to ours that talk about these types of things, like just general health things. There was a
Hmm.
dentist on this one in this specific situation. She's a holistic doctor like myself, and she does more pediatrics. So her stands was very similar to mine. So it's almost like when I was listening to it, it was all those things that I have read about, listened about, talked to my patients about, and it's so nice to hear those conversations happening more often. So I
Hmm.
think just it's not about where you are on this either side of the spectrum. I just think it's
Exactly.
important to have the conversation because the more conversations we have, the more facts we get, the more research that we get. I mean, I know the EPA just did a study in California that brought a lot of light to this fluoridation talk. Utah just adopted a no like a fluoride free thing throughout their whole state,
Hmm.
and I think it's just going to be interesting moving forward. Like how are things going to change in these areas that they're removing fluoride from the water? Like, what is going to be the downstream effects? Because really, when it comes to any kind of change regime or anytime we're trying to kind of mix up the status quo,
Right.
it's really about time and data, and that's really the only way we're going to know. Because having a short study, it does give us information, like it gives us knowledge about that maybe that we didn't have 10, 20, 30, 40 years ago, but having these states that change those things, I think we're going to get a lot more information, and maybe that pushes it towards one way or the other.
Yep.
But I think information is important.
Yeah, and I think that trial and error is also important,
Yeah.
right? To the
That's
fact that
medicine. There's not
exactly.
like, there's studies and there's research, but again, like you said, not everyone's going to respond to the same. It's like having, like, when you think about drugs, like how they
Hmm.
develop drugs, they develop like the LD50, which is the lethal dose at
Yes.
this amount for X amount of people at the bell curve. But there's people on either side of that curve. So how do you know who those people are?
Yep.
You know what I mean? So you go, it's like that's how drugs work. That's how the pharmaceutical industry develops things, and that's how things are prescribed. It's not
Hmm.
like this is going to work 100% of the time for everyone. That's
Yeah.
never the case. You
Yeah.
know?
Relating that to dentistry, I mean, we have a whole aspect of our field dedicated to research and studying these things. But I think what patients should understand, and just anyone who's curious about, should you be, because everyone wants to do the right thing,
Hmm.
right? At the end of the day, we want healthy teeth. We want to make sure that we don't have cavities. Nobody wants to come and see us, honestly. Like, they do, some people love it, but at the end of the day, it's having the understanding that research is evolving every day on this. And like you said, we're not going to know immediately that banning the fluoride completely is going to affect you negatively or positively,
Well, yeah, I
you
mean,
know?
like yourself more than because like people move, they change doctors, they change dentists. Being a good historian of where you started off in life, it's kind of hard to do. Like when you're in
Yep.
late 40s, 50s, and 60s, you've had a lot of life experiences. And I have patients that are great historians that come in and they're like, hey, this is when my first cavity was. This is my first crown was. I know this happened on this day on this tooth. And I'm like, amazing. Like,
Right.
that's fantastic. But most people aren't that way. Most people are like, I just feel like I always get cavities. And
Yep.
then I'm like the first person to talk to them about pH balancing and their diet. And they're like, oh, that's interesting. Because when people think of a healthy diet, that doesn't always coincide with what our bodies are and our mouths are supposed to be exposed to. Because a modern
Exactly.
diet is still going to be more acidic than it ever was before. Or anything we're putting in our mouth and the frequency that we're doing those things, even like some bottled water is more acidic
Yep.
than, other, it's just like it's exhausting. It really is exhausting for consumers, for people just to try to keep up with this stuff. And I just think, the more free information that we have, like these podcasts, to like just educate the public, I think the better off we all are as humans. That's why I'm such a huge advocate of like podcasts, YouTube, free
Yep.
information, because we're all just trying to figure it out.
Yeah.
Like none of us know 100% of the answers because it's never going to be 100% for everyone.
Agreed.
Yeah. I think back to like when I was in hygiene school, I remember learning. So when we were learning about fluoride, at that time, they were saying that the research supported systemic fluoride. So that was a huge, huge thing. But I remember when we were in dental school that the woman who did our pediatric lectures about fluoride, she actually was like, hey, this was this way for 50 years, but we're actually disproving the research that says that fluoride systemic is actually getting um, into the teeth, essentially. Like, it's not actually like occurring that same way. It's more so from the topical exposure of when you're actually getting like the therapeutic effects of it. So there's this
Exactly.
whole now like dynamic of, okay, now we're revisiting this research or redoing this research and finding that there's differences in what we once knew even 10 years ago.
I would like for you to touch base on what do you mean by systemic versus like the topical? Like
Mhm.
what's the difference? Like if someone is listening today and they're like, "Hey, my kid is they get cavities all the time." What's the difference there and what should they be looking for?
Yeah, so systemic fluoride is like drinking
Yep.
water fluoride. So fluoride that it's just in the water you're drinking. If you're drinking tap water, most places in the United States have fluoridation. So once a tooth bud is formed and erupted, so when you are age uh, 2 is when 2 to 6 you're getting all your baby teeth
Right.
to come in or to erupt. So between age 2 and 6, those teeth, as they're coming up, you're actually getting the fluoride therapy from the water that you're consuming touching the top part of the tooth.
Mhm.
It's not going to integrate into that tooth that's already formed from the inside,
Right.
if that makes sense. I'm saying this like as plainly as I can.
Right.
So if you are worried about caries, you should be worrying about what you're giving your kid diet wise.
Mhm.
Um, Baby bottle caries are a big thing. We should talk about that a little bit. So putting your child to bed with a bottle and having them like sip on that all night, like that exposure to milk in itself can actually create cavities if you have exposed them to that caries bacteria.
Yep.
Because caries bacteria, strep mutans, are transferable. We're not just born with them technically. You're actually born without that bacteria in your mouth. You get it from your parents, you get it from people around you, your family
Mhm.
members, all those things. So it's a communicable disease. And the topical fluoride would be like in a toothpaste or
Mhm.
something like that. We actually don't recommend that kids have fluoride toothpaste because they tend to swallow it up
Yes.
until about age 6 or 7, I think is there's pluses and minuses depending on who you are as a child.
Right.
But you're not supposed to actually have fluoride toothpaste because you end up ingesting it, and it's not good for you to ingest, especially the amount. There's actually lawsuits happening right now with toothpaste companies because in their advertisements they put like you put like this huge strip of toothpaste.
Yep.
Like when they advert, like, oh, I'm brushing my teeth. Like Crest was huge on this. Like they had a big blue thing, and that they're being sued for like false advertisement because you're only supposed to have a pea size or a rice size amount of that
Yeah.
toothpaste. So now people are going back and saying, oh, this is like almost like an overdose that
Yep.
you're promoting for people, which I just think is interesting how,
It's interesting.
yeah.
I mean, it's obviously, it's easier to market something if you can see it larger, and
Mhm.
also as a company, I don't know what their philosophies were, but
Sell more
also like
toothpaste.
you're going to use their toothpaste more if you're using more of it, right? And
Yep.
you're going to buy more. Obviously that, you know, it's just interesting because I didn't even know that there were lawsuits about
Hmm.
that. But when I'm teaching patients like pea size amount, they're like, "Oh my gosh, you
No,
don't
no
need
one
that
does
much?"
that. Literally, no. I
Yeah.
used to volunteer and do education for kids like in the local communities ever since I was an assistant, and that was a huge part of it, was going through and like teaching them like this is a right, like a little piece of rice, like you show
Yeah.
them what it is, or this and this. And even now, like I don't like as an adult, you don't need like that same big amount either. You still
Yep.
need like like a swipe or whatever they call the amount now. Um, but yeah, I mean, I use a tube, like my tube of toothpaste lasts me like the whole year.
Yeah.
Like, and some people go through it like crazy.
Yeah.
Yeah.
And so that brings me back to the point of it doesn't matter if there's fluoride in it or not. If a patient is choosing a xylitol toothpaste or a fluoride toothpaste, whatever you're choosing, it's your risk of having the mutans, mixed with acidity, right?
Hmm.
And so you should be mechanically removing the
Oh
biofilm.
yeah. You
And
don't even need toothpaste. I mean, we're not going to get into
yes,
that because I
but
think I've said that enough. But yeah.
you have, but it also correlates. It correlates to the fluoride because whether or not you're choosing a toothpaste that doesn't have fluoride or it does have fluoride, the importance is that you're brushing your teeth and you're getting the bacteria off of the teeth and flossing the bacteria out. It's not necessarily what's in the toothpaste. And in fact, some
Hmm.
of the products that are in, heavily branded toothpaste aren't great for teeth,
Yep.
right?
Hmm.
So it's just having the understanding that the controversy isn't fluoride or no fluoride. It's just, are you brushing your teeth?
Yeah. No. Right. Like
like
let's. Yeah. Exactly. Like
yeah,
it gets down to just the basics. So I think the people that sit here and kind of hark on like, oh, this no fluoride or this fluoride. It's kind of like those same people that go to the gym and they're like, oh, well, this way isolate's better than this way isolate, and
hmm
they're like nitpicking those little. It's
yeah,
like, okay, like you could probably like pull up some facts that one's a little better than the other, but in the end of the day, you're probably going to be healthy and fine
right,
if you're just doing the basic things.
yeah,
But I think the argument against it is that there was so much like false advertisement of it for so many years, or just kind of, I don't know. It's they make these decisions. It's not like you get to like vote on them. Like,
yep,
hey, this is what. Well, now they are voting on them, which is interesting. Um, and I think it is like bringing it back to the public and kind of bringing in some of that new research. Then yeah, let people decide what they want to do. And then if you
exactly,
don't want fluoride in your water and you still are in a fluoridated place, you can get a reverse osmosis system, or you can do those things that kind of remove that fluoride from your household water, and then you don't have to drink it. You don't have to have those things. And they're relatively inexpensive to do that as well. Like we have one in our house. I think it was less than $500, and that was
hmm
one of the more expensive ones because it was a tankless one. But I mean, there's ways to remove it from your water if you don't want to drink it. But then
right,
there's also ways that you can have more of it. You can have all the fluoride that you want,
yeah.
if you really wanted to.
And it brings up an interesting point for me is, or not interesting, but just important, access to care.
Hmm.
So we have to be considerate of other people who, do they have access to a reverse osmosis machine? Maybe not.
Right.
So, are we putting them at, you know, it's like, are we putting them at a worse state if we're saying you can't have fluoride in your water? Well, maybe that's the only way that their kid's teeth is like,
Well, I think that's again going back to like where does it come from? I think that's
right.
where it kind of came from is, or I think from a lot of dentist perspectives of why they support it is because they do work in these like rural areas or hard access to care areas, or areas where they had to literally people to drive hundreds of miles,
Yeah.
whatever it may be, to get to a dentist. And is there an education program that we can put into more, to help
Yeah.
those people, to educate them?
If
And it all comes down to what they know and what they're told. I mean, people literally feed their babies Mountain Dew. Like that's a
right.
real thing in like
Yeah.
Appalachia and like those like not even Appalachia, down the street from where we live here. You know what I
Yes.
mean? It's like
Right.
not just like in the middle of these kind of rural areas. It happens everywhere.
It
And it
does happen
happens like
everywhere.
when we've traveled to third world countries, we've done humanitarian trips in them. And I mean, to me, like when I'm traveling to these like other parts of the world, like people are literally like buying liters of cola
Hmm.
and just drinking, like their kids are drinking that. Like you're seeing them on like the side of the road walking with no shoes and this, but they're drinking because that's cleaner than the water that they have access to. So it's
Yeah.
like it really opens up this conversation of just humanity and how access to clean drinking water in itself, I think, is just
Yeah.
like a problem.
So, and from a public health perspective, if we're removing fluoride from the area, are we introducing more funding or resources for educational programs then?
Right.
Right?
And that's
And
what I think the conversation should really be. It should
yeah,
really be, hey, we're going to remove this, but like why do we do it in the like
what
where's the gap there that we're not solving the problem?
where was the initial need or the idea of the need for public fluoridation? And maybe we're taking a step back and analyzing that now and like,
Hmm.
hey, maybe we're removing the fluoride, but it's because we know better and we know how we've evolved and changed over time. We have more
Hmm.
science on your risks, so maybe you should be educated on how to prevent cavities,
Hmm.
right? Not
Yep.
just by public water fluoridation.
Yep.
Yeah. So,
And I think that is where the conversation is heading. I will never run for public office, and I will never be that person
neither will
to.
I.
But I will advocate for public opinion to be heard on this, and I do think it's important to listen to the facts, to listen to those little nuance studies that are coming out, or kind of go back into the history. I mean, that's part of what the IAOMT does is they actually delve into all of the research on this and they compile it, and you can sit there and read it all if you really wanted to. And people do, like people in that group of people, like they really do read all the research articles.
Hmm.
And it is amazing to know kind of what the history of where it started, the people that started it, and the profiting that came from that initial. Like it's really like it's a mind blowing thing, but it's also like a tale as old as time.
Right.
You know what I mean? Like anytime there's an ability to kind of change something in the public and profit off of it, it's gonna be there.
Yeah, and I think for us, what we're focused on, it's not so much, you know, profiting off of this or not, it's changing people's mindsets.
Hmm.
So your mindset shouldn't be, they're taking away my fluoride or, we need the fluoride. It's your mindset should be, what if I laid out, uh, a menu for you and I had 6 different options of ways to keep your teeth healthy. You can choose any of them,
Hmm.
right? One of them maybe being public fluoridation, but the other 5, maybe being your diet, right? Your nutrition, you're balancing your pH, your oral hygiene habits. Are you flossing or not flossing? Why are we so focused on option number 1 on the menu when there's so
Hmm.
many other things that they
Yeah.
should be considering as well? But I think it's really important that people should be open-minded. Be
Yeah.
open-minded to change and have a mindset of, why is this even occurring?
Hmm.
Why is this up for discussion? And how can I stay healthy throughout the changes?
Yep, yep, I agree. I think just taking your health into your own accountability and just trying to do the best you can. There's so many free resources. There's our podcast. There's all these different things. There's the IOMT website if anyone wants to just dive into that side of things. There's the ADA website, which you can kind of get both sides of that. And I think it should be an individual choice. And if you have questions, if you want to ask us questions, go for it.
Yeah, feel free to comment,
Yeah,
and we would love to hear from you guys.
yeah, definitely. Well, thank you for sharing your amazing thoughts and perspectives as always, Dr. Caleb.
Of course.
And we'll see you guys next week.
We'll see you back.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.